We want to begin with some important health news for families. In recent weeks across the country, there has been an alarming increase of illness among young children. And it's not COVID, it's something called RSV. Hospitals in at least 33 states are seeing a dramatic rise in cases of children suffering from the respiratory virus. Cases have more than doubled in 25 states over the last month, and it's putting a strain on hospitals. Some healthcare facilities are so overwhelmed that they're running out of beds. The state of Connecticut is even thinking about bringing in the National Guard. We have a lot of news to get to tonight, and CBS's Omar Villafranca will start us off. Good evening, Omar.
Good evening. Tonight, hospitals from Texas to Connecticut are sounding the alarm. Their emergency rooms are filling up with RSV patients. There's no vaccine, and doctors are bracing for a rough winter.
At Connecticut Children's Medical Center, doctors are slammed with a surge in RSV cases. Dr. John Brancato says every inch of the emergency room is filled.
We're having patients in hall beds. We're using our orthopedic room. We're using other treatment rooms as much as possible.
RSV cases typically peak in December to mid-February. But this month, the hospital has more RSV cases than any other respiratory illness, including COVID.
A lot of the patients that we're seeing now are sicker, so they need immediate assessment.
Further south, almost half of the ICU beds at Cook Children's Hospital in Fort Worth, Texas, are filled with RSV patients. Dr. Daniel Guzman is treating them.
It's going to be a rough winter. I mean, we're already seeing our numbers spike over the last few weeks with over 550 ER visits per day.
4-month-old Lindy is in the ICU. Her parents, Zoe and Jeff Green, took her to an urgent care clinic, concerned that she had more than just a common cold.
I was like, something's not right. This isn't normal. She feels hot and kind of already lethargic, and that's from the fever.
RSV symptoms are similar to a cold, but doctors say parents should watch for signs of respiratory distress if their child's nostrils are flaring while breathing, or if their skin is pulling in towards their ribs.
When your child transitions into, well, they're breathing harder, they're breathing faster, their head bobbing, take some more action. Call your pediatrician.
Jerry Akers brought her 19-month-old son Nash back to the ER after his RSV symptoms got worse.
You know your kid, trust your mom instinct, because we were here on Monday, but my instinct this morning was like, I need to go back.
Omar Villafranca is back with us. It is hard to watch those kids who are suffering. So what should they do?
Doctors are asking patients to get the flu shot. It won't prevent the flu, but it could make their symptoms milder, which could prevent them from having to make a trip to an already busy emergency room. Norah?
Everybody on alert. Omar Villafranca, thanks so much.